Hello, everyone. My name is Kendra Keels, and I'm the Industry Development Director at Veal Farmers of Ontario. Welcome to our latest webinar for finished grain-fed veal producers. Thank you for joining us today. We are excited to dive into a topic that is critical to veal production, but often flies under the radar: liver abscesses in cattle. These hidden health issues can quietly impact animal performance, meat quality, and ultimately the bottom line for producers. Today, we are joined by Dr. Gabriel Ribeiro, a veterinarian, associate professor, and Saskatchewan beef industry chair at the University of Saskatchewan, who will explore the key risk factors that contribute to liver abscess development and highlight practical prevention strategies that producers can apply on their farms. Please welcome Dr. Ribeiro.
Hi, everyone. I would like to thank the Veal Farmers of Ontario for this invitation to do this webinar here for you. I'm very excited to have the opportunity to talk a little bit about managing liver abscess in cattle and practical strategies for producers. I will try to talk a little bit in general about liver abscess in cattle and where possible, try to make some comments or where it's more applicable for veal or just regular beef. But to start, I want to start with our outline here. I want to first kind of define the problem, explain what this is and how big is this issue, then get into a little bit the pathogenesis, how does liver abscess happens, what causes it, and then get into diagnosis, how can we identify liver abscess, then a little bit into the incidence of liver abscess, what affects that incidence, what we know so far, and then spend more time talking a little bit about more about combating the problem or preventions that we have to reduce these issues we have been seeing in cattle production, in beef cattle and veal production, and then finish with some final considerations. So liver abscess, what is liver abscess? Liver abscess is these bacterial infections that you can see in the liver of cattle that form this purulent pus, kind of like balls that you can see in the liver on the superficial of the liver, but also inside the liver. So when bacteria gets into that liver, it can promote or generate these abscesses, right? So these infections can happen in the liver through can come through different routes into the liver of cattle, right? So as you can see here, I kind of like put for you different ways where bacteria can reach the liver. So it can come through the hepatic artery, right? So if there is any kind of septicemia or any other kind of disease in the blood of cattle through the artery, that bacteria can reach the liver and cause liver abscess. Through the umbilical vein here in a young calf, right? If that umbilical vein, there is not proper healing, and then you can have contamination there, and the bacteria can ascend through that port and get into the liver and cause liver abscess. And then when we have also some bile duct infections, right? For example, when you have fluke in cattle, and then as a consequence, you get a secondary infection, you can have liver abscess happening. You can have direct extension. What that means is like you have an infection in an adjacent organ or organ close to the liver that by connection, by proximity, it leads to infection to the liver, and it's common in reticulum peritonitis. Whenever you have like a foreign body, like a nail or something that cross that reticulum and then reaches, it can reach that liver. And can cause infection in that area and lead to an infection, I guess, liver abscesses too. But the most common and the majority of our problem comes from bacteria that comes through the portal vein. The portal vein is what kind of drains the digestive tract, right, from the rumen all the way down to the cecum, so the intestines, everything gets drained by the portal vein. And then that blood that comes from that digestive tract goes all the way through the liver, and then and through that route, bacteria that comes from the digestive tract that can be the rumen, can be the lower intestines, anywhere, can reach the liver and cause an infection, leading to these liver abscesses that are can be can have a different range from minor, very few little abscess or very localized, that just one small, to completely can completely take over the liver and be multiple and very large liver abscess that can cause adherence to adjacent organs to the carcass and can cause a lot of damage. So just to get into a little bit before we get do discuss this a lot, it's important to understand how we classify liver abscess. So we usually rank them as a 0 if there's no liver abscess, as you can see in this figure here, to an A if there's a small or two small unorganized kind of abscesses, or scars. Okay, and if you have more than two or liver abscesses, and it's completely or a very large liver abscess, it's going to be an A plus. Okay, most of the issues that we have in terms of reducing carcass weights and qualities related to the A plus liver abscess. The A liver abscess, we have not much of a problem in terms of reducing carcass weight or growth performance of cattle. However, that changes the destination of the liver after slaughter. So this type of liver, the A's, cannot be used for human consumption. The zeros can be used for human consumption. The A might be destinated or go into pet food chain, and then the A plus cannot be even used for pet food chain, and then will be condemned, right? So this is going to be losses that will happen with this type of liver. So what's the big issue? What's the economic impact of liver abscess? Why do we care, right? So depending on the severity, right, of that liver abscess, then the impact will be different. And like I said a little bit earlier, most of our problem, the main problem, is the A plus or the severely abscessed livers, right? So those will cause liver condemnation. It will reduce carcass growth performance, cattle growth performance, reduce carcass yield and quality grade. And to the slaughter plants, it can also interrupt the flow of cattle during slaughter, right? And increase costs due to time and labor associated to, for example, if during slaughter a carcass with a very abscessed liver that liver ruptures and contaminated the carcass or contaminate the floor or the area that needs to stop and clean, and all of that, that can be quite a big problem. And that happens quite often in this type of cattle that have severely abscessed livers. So when you put all together these losses, they can be quite major. Some recent work, not very old work here from Baptiste in Holland, has shown that a pen of cattle with 20% of cattle with liver abscess is estimated to have increased energy requirement compared to cattle that have no liver abscess, but around 4%, right? So that means you need more feed to feed that cattle, right? So feed efficiency will be reduced in that case. When we look at the impact of recent data analysis here by Grimes et al., with over 1 million head of cattle in that database, they observed that cattle with A plus livers had 29 pounds lighter carcasses than cattle without any liver abscess, right? So it's a huge loss in weight in those carcasses by having liver abscess. And then Ty Lawrence here did some calculation in what would be the cost of that to the industry, right? So if you're just losing the liver itself, would be around $11 per animal. But as we discussed, it's not just the livers, right? So if you consider on those A plus cases that you have a huge loss in carcass weight and yield, right? That there's an impact on growth performance, and then you can also affect the flow in the slaughter plant, right? So this can add up to $275 Canadian dollars, I guess, per animal, right? So this, if you multiply by the number of cattle that we slaughter, it's a huge number, right? So by his calculations, In the U.S. Industry, this issue adds up to around 1 billion US dollars, right? In Canada, we don't have like the same numbers, but I will show a few numbers in the next slide here. Here's just to kind of like show that impact of liver abscess, especially the A plus on hot carcass weights, dressing percentage is reduced, and the trimming, right? Because a lot of these A pluses cause adherence to the carcass, and then there's some trimming that needs to be done to clean those carcass where the liver abscesses are adhered are connected, and then you can see the trimming increase quite a bit, and that affects your carcass weights, right? But here in Canada, we had the Canadian Beef Quality Audit that you can see the numbers here from 1999, 2010, 2016, kind of where what has been happening with this issue in Canada over time. You can see that liver abscess in cattle has increased from 1999 to the latest report that we have. But not just the total liver abscess, but the amount of A pluses or the severe liver abscess, which is the main issue, has drastically increased. We have around 20% here in this 19, close to 20% in these latest reports from 2016. However, we don't have a new report yet in Canada, and our what we think from what we see in the industry is that those numbers have gone up. So we are on the high side here, probably around the 35% as a whole industry, beef industry, in terms of liver abscess. But the A pluses liver may have also increased during this time. We just don't know, so we can't really calculate exactly what would be the economic loss right now without a more recent Canadian beef quality audit, right? So hopefully this data will come up soon and we can kind of updated some of these numbers. But I wouldn't be surprised if these numbers today and with the cost of beef today are around $100 million in Canada. So how does liver abscess happen in terms of like what leads to or causes liver abscess? So the most accepted theory related to liver abscess is the one that talks about ruminal acidosis in cattle. So when you're feeding high grain, highly fermentable diets that cause ruminal acidosis, that leads to like inflammation of the ruminal wall, what we call that ruminitis. You have the break of the barrier of that ruminal wall, right? And then that leads to infection of the ruminal wall to bacteria, a specific group of bacteria, as we're going to talk about them in a little bit. And this bacteria then will, after infection of that the ruminal wall, will through the portal blood, gain the portal blood vein here and reach the liver, causing those abscesses, right? So this is the most accepted theory that we've been taught in over 30 or 40 years now. And it is true, and then there is a lot of data to support that. But there's a new thinking that has been accepted for most groups in North America now that works with this in this area and studies liver abscess is that when we have ruminal acidosis, right, when we're feeding high grain diets and very fermentable diets, we not only have ruminal acidosis happening, but we also have acidosis happening in the hindgut. As you can see here in a study conducted here at the University of Saskatchewan in 2018, they saw that cattle that were on an acid that had acidosis, they also had lower pH in the cecum, proximal colon, and distal colon. So this new thinking, taking this in consideration and looking at the difference in epithelium of the rumen and intestines, that you can see here, the ruminal wall has like a four-layer of cells here, and compared to this intestine, which we have this mucus layer and just one layer of epithelial cells. So it's a In addition to that, the intestine has a lower ability to buffer acidity. So it's expected, or this new thinking thinks that because you have acidosis happening not just in the rumen but in the intestine is less capable to deal with that acid production and to buffer that excess of acid production. We start to have more lesion and more infection in that epithelial in those epithelial cells, and then it would be more likely to have bacteria escaping the intestine than the rumen. And a lot of this thinking, or that changing thinking, came due to very often we found cattle with liver abscess that had no signs on the ruminal wall of any acidosis or any scars or anything leading to ruminal acidosis specifically. And in addition to that, through sequencing and culturing, has been shown that they were also able to find bacteria that cause liver abscess, very similar bacteria that was in the liver present in the intestine, right? So all of that has led to a lot of researchers nowadays trying to investigate not just the rumen but other parts of the intestine. And due to those morphological differences and then physiological difference of the different regions of the gastrointestinal tract of cattle, it's likely that a lot of the liver abscess are coming from the hindgut, but that doesn't mean that we don't have infection or liver abscess happening from coming from the rumen too. It's important to note that the microbes that cause liver abscess here, they live very close to the ruminal wall. And then anytime that there is a damage or degeneration to that epithelium, that they can contaminate that and infect that ruminal wall and then gain access to the portal vein, they can kind of reach the liver. In terms of the bacteria, of the microbes that are causing this issue, right, the liver abscess, data from Nagjara here has been studying this for many years, show that most of the based on culture method, like trying to get a sample of that abscess in culture, the microbe itself, most of that the microbe causing that, over 85% here, is this specific bacteria, Fusobacterium necrophorum. Okay, but there is also other bacteria that they found. There is also this Fusobacterium fideliform, and there's Streptorella pyogenes, Salmonella enterica found sometimes, and there's other microbes that they didn't classify that can also be leading to that. However, this is a culture method. So a lot of bacteria, we don't really know how to provide specific or good ways to culture that, or we don't have data into what's the best way to culture them. So very often we can't grow them, so we can't identify them. So more recently, people have been working quite a bit in trying to use methods that are not dependent on culturing, like sequencing, taking those samples from liver abscess and doing RNA, DNA sequencing, and trying to identify the microbes that are associated with that liver abscess. And you can see here then again through sequencing, Fusobacterium is the one that it's mostly that it's number one microbe present in the liver abscess with 86%, very similar data than Agar by culturing. However, there is a different group of microbes that weren't identified before by culturing. That's quite important, that we're seeing more and more with this sequencing data, which is bacteroidetes, right? You can see here that they show up in 12% of those samples. And similar work that was done here by Pinel and Morley show the same thing based on meta-analysis of sequencing 16S amplicon sequencing data from liver abscess published studies. They observed that most abscess were dominated by Fusobacterium, like the study above previously that by Gruner and Gerold. But they also saw that 50% in some studies of the microbes in that liver abscess were from bacteroidetes, and they're shown in those orange bars here. So that seems to be a quite important bacteria associated with this issue too. So Our problem right now is diagnosis because our main challenge is that we can only diagnose liver abscess at slaughter after animal it's slaughtered when feeding is already done. So we don't have there's not much we can do. It's past the fact, right? So we can only reevaluate what we did and try to do better next time, right? So there's no way to treat animals before they go to slaughter, and this is because cattle don't usually show any signs, any clinical signs of liver abscess, right? So we detect them at slaughter. Right now, there's some work that's been done into blood markers to see if they could be used, if you could take a sample and then predict liver abscess. Right now, there's no specific markers for blood for liver abscess. All the work that has been done so far has shown some changes in non-specific markers that are associated with infection in general. That doesn't really help too much. And there is some work done with ultrasound. So ultrasound can be used in with a live animal to kind of visualize the liver and then try to detect liver abscess. The main problem is you can't visualize the entire liver in a live animal. The left lobe is hidden with other organs, and we can't really visualize them well. And as cattle get fat and older, the resolution gets reduced, and we can't really identify well liver abscess. So that makes quite challenging to use that techniques also to visualize. So that has kind of delayed our understanding and the move in the way how fast we can move science into solving this problem in the industry, just because we can't uh, we can't know for sure, or if we're trying different strategies to reduce liver abscess, we're trying to treat that liver abscess. We can't know if the cattle has liver abscess or not until it's slaughtered. So this is kind of how we do in practice, right? This is one of my students in a recent study that we had at the slaughter plant. And as that gut comes after animals are slaughtered, we looked into to the liver, and we take those scores like we described earlier in this presentation. And here you can see a very large liver abscess on that liver, and you can see here an internal abscess, right? So as the people in that plant are looking and inspecting that liver. They usually put their hands over that liver, and then they can feel a node. And then as they cut through that, you can see that they find the liver abscess that wasn't very, they could not detect just by looking. So putting their hands on that liver is also important to feel that liver abscess that can be kind of hidden from the superficial area here. You also have some that will come with marks like this. This is just a scar of a liver abscess that has been healing here. It's in end of its progress. So what causes what drives this increased incidence of liver abscess, right? So right now the incidence is highly variable. When we go to different farms, it's very variable. Most commonly, we've been seeing ranges between 10 and 32%. However, and this is data from the US, but here in Canada, we are probably more around the 32% on average, or 35% on average, I would say. However, we do see some feedlots, some feed yards that have very low liver abscess, less than 5%, and we see others that have very high numbers, over 60 or even over 80% liver abscess, right? So this is a huge variability, and sometimes looking at averages doesn't tell you the full picture, right? So we need to really pay close attention into those farms that have a high incidence and try to understand what's happening there, and look at the farms with low incidence and try to compare and try to from that kind of understand a little bit what's driving some of that. We're going to discuss a little bit what drives some of those things, but trying to think a little bit about that is important. Um, some things that it's well known by the industry is that we have a higher incidence of liver abscess in steers compared to heifers, especially A plus liver abscess, that the more severe abscess, and that has been associated with the greater dry matter intake of steers compared to heifers. And again, we accept that as being the reason, but again, we don't really know for sure if that's the reason. But the most accepted theory is that is related to increased dry matter intake of steers compared to heifers. And the same thing, we see a greater liver abscess in dairy calves or dairy beef compared to beef cattle at slaughter. Uh, and that's also been related to increased dry matter intake of dairy steers compared to beef, but also beef cattle compared to dairy cattle, right? The greater intake of dairy, but also longer days on feed, days on feed for dairy cattle that's usually required to meet market weight, and that can also lead to a larger incidence of liver abscess, right? In terms of like beef on dairy, that has increased quite a bit in the last few years. We've seen a lot of the dairy producers putting beef genetics on dairy cows and making beef on dairy. We don't have a lot of data on that yet, but according to the industry, it's assumed that beef on dairy has intermediate incidence of liver abscess between beef and dairy cattle. So it will be lower than dairy, but higher than beef cattle. It's important to note that Holstein cattle also not just have more liver abscess, but have a very large proportion of those are A pluses or severe liver abscess. That is really the big problem we have with liver abscess. So really not a great news here for beef for dairy calves, right? Um, Also, we see difference into location, and that's really poorly explained. Very often, we don't have a lot of like well-designed studies to explain that. But for example, in the U.S., they see usually greater proportion in central and northern plains, and a lower proportion in Midwest, Northwest, and Southwest plains. We also see at slaughter greater amounts of liver abscess on the summer months compared to the winter months. And We also see greater proportion of liver abscess when cattle are fed silage compared to hay as a roughage source. And we see also more proportion or more liver abscess when cattle are fed highly fermentable grain sources like wheat and barley compared to a bit less fermented, slower fermentable sources like corn and sorghum. However, this is highly affected by the grain processing, as we're going to show a little bit later. So, depending on the processing of that corn, you can make it highly fermentable, and that can also increase the risk of liver abscesses. So, the way we process the grain can affect that, and it would be some of the things we would do to kind of manage that issue with liver abscess. So just getting into prevention, just I want to start out saying that there's no one approach to this, right? So really, if you want to tackle this, we need an integrated approach, and we need to look at everything we can do to minimize the risk of acidosis, but also to minimize stress to cattle, to improve immunity of cattle, and to prevent this disease. And this is important because there's a lot of things we don't know yet about liver abscess. One of the things that's interesting that we just learned about liver abscess is this: a healthy liver also has this. You can also culture or you can also sequence and identify the same pathogenic bacteria that we find in the liver abscesses. And the question becomes why that healthy cattle, have the bacteria in the liver, but does not develop liver abscess, and then that other animal develops a liver abscess. So there's a lot of people studying that. We think that's related to the immunity of cattle and the ability of that liver to fight infection. Seems like we always have bacteria reaching the liver, right? There is always bacteria escaping the gut, for example, and reaching the portal vein and getting into that liver. But for some reason, some type of stress to that animal, the immune system is not working to its best, and then it leads to the development of those liver abscesses. Those are some things we think that are happening that we need to pay attention to. Anything we can do to reduce stress and improve immunity of cattle will definitely help and prevent liver abscess. Something to have in mind. So if you're thinking about young calves or veal, like making sure animal are getting starting well from the from birth on, so giving them like colostrum so they have proper immunity early on, but also how you feed them before weaning and then how you transition them to feeding after weaning would be very important. Okay, that winning strategy, making sure animals are we are making sure they're eating well before weaning, and when we have that, we make sure that there's not an abrupt change in feeding in that weaning process, so we can minimize that issue of acidosis and leading to liver abscess will be important. Um, Really designing well your adaptation to high grain diets, working with your nutritionists, with vets, and everybody to put feeding programs that will get animal eating those high energy, highly fermentable diets uh, well without promoting liver acidosis and consequently liver abscess will be very important. So consideration for the grain source that you're feeding, going back to the difference between grain in terms of fermentation in the rumen, how fast it ferments, and how we process that to prevent very rapidly fermented material in the rumen that can lead to acidosis. So that grain processing, you're going to get a little bit more in the next slide, but also will be part of that prevention bunk management, making sure cattle has feed and all cattle in that pen can eat at any time throughout the day is going to be very important. Make sure there's space for that animal to eat is going to be very important. Pen or housing conditions are going to be very important too, making sure they're clean, right? There's less contamination, making sure animals can reach and walk and reach the bunk and walk and reach the water bowls, making sure water bowls are clean. All of that will help with prevention. Control of other disease, right? Like BRD and others. There is a big link between other disease like BRD and others linking to also having problems with liver abscess. Like we said, like I said earlier, if they have any septicemic kind of state or there's bacteria in the blood of that cattle that can reach the liver, but also all this other disease state will affect intake, can lead to more acidosis happening upon recover, and can also lead then to liver abscess. But also it will affect the ability of that the immunity of that cattle if there is other disease happening, and the ability to fight infections in the liver. Okay, so that's quite important. Antimicrobials, currently in feed antimicrobials, one of the most common way to prevent. This is just part of the problem. We're going to show you a little bit here that it doesn't really solve your problem, but it can be used to support and prevent some of it. There's a lot of questions we get all the time in terms of direct, and the industry has been the pharmaceutical industry been really interested in the feed industry too, in developing direct fed microbials that can support or reduce liver abscess, but the data has been quite variable, and really we don't have like a really good product in the market that can really solve the problem, but it could be used in this integrated approach as one extra way to try to mitigate issues with liver abscess. Um, so we've been talking quite a bit about the issue about the fermentation and leading to ruminal acidosis and hindgut acidosis, right? Uh, so when we look at the acidosis, it's kind of a balance, right? We have acid being produced and acid being neutralized. So the focus on this prevention should be in balancing this out. So we need to make sure we don't produce too much too fast of acid through fermentation, and that can be to diet formulation in grain processing are ways to kind of adjust that, but also the way you feed cattle to make sure cattle don't have very large meals. They can eat more spread out throughout the day. All that can help acid production, so there's not too much being produced at one time. But also we got to make sure that we have appropriate buffering, and that buffering might be through saliva production, also through absorption. There's a lot of buffering that happen to a proper or absorption of the volatile fatty acids that are produced during fermentation in the rumen. And that happens when you have a healthy rumen with a lot of papillae area of absorption. During that exchange of VFAs, we have bicarbonate being released in the rumen from the blood that goes into the rumen and buffer that rumen. So that's quite important. So adapting cattle to feed slowly is important and is going to make sure that cattle has a lot of papillae and area of absorption to reduce that issue. Also, the passage of that liquids throughout the gut from out of the rumen and so on will reduce the amount of acids, and that's another way that can reduce and help with that neutralization, right? So that acid production and acid neutralization are things we're thinking when we're trying to reduce that acidosis, and any way we can do in terms of management to mitigate that will help. Here I have for you like a figure that was developed by Dr. Greg Penner here at the University of Saskatchewan that has been just published in the Ruminal Health Compendium, which he tried to link how this issue in terms of like linking the gut with disease states is not just liver abscess, but I'll focus more here on how all of this kind of connects to liver abscess. So according to a lot of work that Dr. Penner and others have been doing in this area, management, diet, environment, disease, animal behavior, and all of that can affect intake of cattle, right? So a lot of these the stresses or management issues or disease, they will lead to reduced intake, right? That temporary reduction of intake will reduce absorptive capacity in that rumen and will reduce surface area of absorption in the rumen, will then lead to more accumulation of volatile fatty acids or acids in that rumen, and then that will decrease the pH in that rumen, right? So all of that will then promote ability for microbes to then pass from the gastrointestinal tract to the blood and then reach the liver. So here just showing that those transient or dry matter intake issues that we see happening, transport, for example, can cause that too, right? That stress of transport and that long period of time without feed. When they get on feed again, they might eat too quickly, and because they were without feed for a period of time and they reduce their ability to absorb, they will produce a lot of acids, and that can then will cause low ruminal pH and can lead then to that passage of those microbes after infection of the epithelial wall in the rumen or the lower intestine, and then reach the liver. So it's a complex problem. You can see here through this figure that tries to integrate many problems we see with cattle. That's not is not going to be simple to deal with that, and we really need an integrated approach if we want to tackle or reduce that problem. There is old data that shows, right, that if you feed more forage or roughage in the diet, we reduce the issues with liver abscess, right? Seems simple. So if you feed above 15% roughage level in the diet, you should have low problems with liver or low reduced issue with liver abscess. However, it's a simple thing to do. It's not that simple, right? There's a lot of data that shows that as we increase the amount of roughage in the diet, we decrease feed efficiency, right? And that decrease the profitability of the industry, right? So we need to consider those things, right? So it's a bit more complex than that. However, we don't see much issues with liver abscess when we're feeding or if you're finishing cattle on a high forage diet. So I just kind of summarized data here in terms of the impact of roughage inclusion in recent studies on the feed efficiency, average daily gain, and dry matter intake, and really indicates why we feed how we feed beef cattle in finishing diets here in North America, especially in Canada. You can see that as you increase here roughage inclusion on a percent of the dry matter or roughage NDF as a percentage of dry matter, doesn't matter. You can see that dry matter intake linearly increase for most studies, average daily gain It has kind of a curvilinear, kind of like a U shape usually, which is it increases up to a point when you add a little bit of fiber, but then it decreases when you add too much fiber to that diet. But when we look at gain to feed or that feed efficiency, it reduces, right? It takes more feed to gain, or they gain less with the same amount of feed as you increase the amount of roughage or forage in the diet of those animals. And so that's why most of finishing cattle, we see inclusion of roughage around that 5 to 12% range as a percent of diet dry matter, or roughage and DF inclusion around 5 or 6% of the diet dry matter, right? And this data here, this recent data based on all these studies, is very similar to what we see in terms of the impact of NDF inclusion, roughage inclusion in diets that was published early on by Galen and D4 here. You can see kind of that linear increase in dry matter intake as a percent of body weight as you add more roughage in those diets. So it's not simple, and it's not something that the industry is going to change quickly, especially as feed prices are not going to be going, or forage prices and feed prices are not going to be going down very quickly. Uh, so we will likely be feeding very similar in the near future. When we focus on diet fermentability, or that the issue with grain fermentation in the rumen, here's just a figure that kind of tries to rank them from slower to faster fermentation in the rumen. And you can see clearly that when we try to look at cattle that are fed those different cereal grain processing uh, type and method, we usually see more liver abscess in that type cattle fed that type of grain than the ones in the bottom. So it's really well or closely associated to that liver abscess. And that's associated with that ability when you process that grain, when you use that type of grain, to that degradation, how fast that degradation happens in the rumen and the ferments producing those acids. Here's just some study that look at fermentation in the rumen of the whole, or degradation in the rumen of the whole grain when you cut in half or you cut in 4 pieces. And you can see that by doing that with wheat and barley, the top two lines here, the fermentation drastically increases when you cut in half or when you cut in 4 pieces. But that doesn't happen the same way for wheat or for corn or maize and sorghum. But if you have high moisture corn, which is common in Ontario, right, you can have a much more fermentable diet that can lead to a greater risk of acidosis, and that's something we need to be careful with if you're using high moisture corn. So other factors that will be important is factors that lead to variation in daily feed intake. We talked about that variation in daily feed intake can lead to acidosis, right? Any restriction of feed intake, or any weather, like winter storms, anything that can affect how animals eat. So if they don't eat well for one day or for a long period of time, whenever they come back to eat, they might overeat and lead to acidosis, right? And the same thing will happen if you have a misfeeding, or if you delay feeding of cattle. If you're in the beef industry, or if you're feeding cattle, you know that cattle likes routine, so they like to eat every day at the same time. They like to eat the same thing every day. They like that routine, right? And that's going to be really important if you want to prevent any issues. So you want the diet to be always the same and fed the same time, and you want to make sure that all animals have access to eat that. You want to reduce as much as possible fines in the diet, right? Fines from grain that can lead to that excessive acid production and be a problem during poor ration processing. And we see very often when the rollers are not adjusted properly, you can have very high amount of fines being produced that will lead to that acidosis. Same thing if you have stale or moldy feeds, right? That can affect intake of cattle, and then that can also promote variation in daily feed intakes that will lead to acidosis. If we move cattle too quickly on feed, if you're trying to rush things up, That's not going to be good. That can lead to that. And pen conditions, right? Making sure we have dry pens, we have clean pens will be important if you want to prevent those issues. Any of those feed management errors that lead animals to get hungry and then later on they consume too much feed will lead to those cases of mild to severe subacute acidosis that can then lead to liver abscesses, right? So those are things we need to be as we manage our farms that we need to be looking for and to prevent that. So that's going to be quite important to manage liver abscess. So when you think about that, we need to think about how we bring cattle into full feed, how we step up cattle, right? So make sure you're step them up gradually. Usually we do that between 21 to 28 days, and we use different diets and making sure we give at least 3 to 7 days in each step, so we don't change those steps too quickly. Make sure we don't change forage to concentrate too quickly, right? Like usually, as a rule of thumb, we don't want to increase grain and decrease forage by more than 10% each, right? All of those kind of help in preventing huge change. Just kind of be real careful when you're doing that adaptation and how they're getting fed during that time will help quite a bit. Making sure that we slowly adjust and increase feed over time, that cattle are not getting hungry. Okay, be very important. We want to make sure that the cattle rises in intake constantly, right? Like that week over week, you see that increase in intake until they reach that plateau. We don't want to see variation from day to day in intake or for week to week in intake. Going animals kind of going back, right? So here's just kind of like some feed intake patterns that you see in different pens, and very often due to poor management, we see cyclic intake pattern like this or like this in the bottom here. And you can see that these are not what we want. These will definitely lead to acidosis and chronic acidosis, and they can lead to liver abscess. So we don't want that. We want to make sure animal will start on feed and continuously start to increase that intake until it kind of reaches that plateau. And sometimes you'll see little drops in intake. That happens, and in the end of the feeding program, it starts to reduce, right? Usually, as they get very heavy, that might start to reduce. But as long as the changes are slow and constant, and you don't have that bouncing up and down, as you can see here, the large drops and large increases and large reductions, usually that should be fine. So that's kind of the desired kind of intake that we want to see, how we want to bring those pens. So if you have a feeding program or management, you can kind of keep track of how the feeding is being done and what's happening in those pens. And if you have something like that or like that in the bottom here in your left side, uh, you have more issues and likely you will have more liver abscess than if you have a pattern of intake in the pen that over time is more like that. So bulk management is huge important in this area. So we need to feed well distributed and throughout that bunk. So all animals need have ability to eat, right? We don't want to put all the feed in one corner of the bunk and leave the rest open, right? Because that prevents some animals to reach feed and it creates that stress that's not necessary, right? We want to make sure we have adequate bunk space. We don't want to put too many cattle and then cattle are fighting to eat. And we see right now like a lot of feedlots, a lot of places adding a lot more cattle than in the past to their to their pants without changing bunk space. So those are things that, as we started to do over the years, will influence liver abscess. So you have to rethink that if maybe do I need more bunk space? Is there anything I can do to improve that space or that access to feed to cattle to prevent that variation in intake and cattle being hungry or waiting too long to eat? A lot of the feedlots and feeders use slick bunk practices, right? And those are used because you can improve feed efficiency, reduce wastage, and increase profitability, and make sense. However, we need to understand and train our people that are doing this to make sure it's a proper slick bunk management practices, right? That cattle is not actually getting hungry. Cattle need to be content. They should not be competing crazy for feed, getting hungry, because if they are, then that's not slick bunk practices, and we will have more issues with acidosis and consequently leading to more liver abscess. In feed antibiotics, just kind of another way we have used, or I think maybe we have relied too much on liver abscess over the years, and it's something that there's a lot of pressure now to change, right? So currently, is mostly used to is mostly in feed antibiotics, mostly used to control liver abscess. However, we have changed over the years. We need veterinary prescription to do that. However, most feedlots are getting prescription to using feed antibiotic to support or help with prevent liver abscess. Okay. However, we have a lot of pressure from society due to excessive use of antimicrobials and the link with antimicrobial resistance and how that can then maybe pass from the animal side and reach humans, right? Cause issues with humans in the future. In since 2018, right, we've been we need a prescription to any antibiotic we need to use, we want to use, and that antibiotic can only be used to prevent disease, and in this case, liver abscess. So you will need, if you want to use an antibiotic, you need to work with your veterinarian to get that prescription. And that prescription is not to improve carcass yield. The prescription is not to increase feed efficiency, only to control liver abscess and for the health of that cattle. Um, so the mostly used antimicrobial or antibiotic in feed to control liver abscess is stylosine. So usually fed at 11 milligrams per kilo of diet dry matter. It works on gram-positive bacteria, but it's also effective against gram-negative bacteria that's associated with liver abscess, like Fusobacterium and Treponella. There's no withdrawal period for this antimicrobial, and according to CFIA, it can be fed alongside other feed additives like monensin, MGA if you're feeding heifers, right? Or lubabergon, which is a beta-adrenergic modulator, right? That a lot of feedlots are using nowadays. Tylosine. Earlier work has shown that they can also improve feed efficiency and average daily gain. However, a lot of newer work has shown here, as I cite here, that the use of tylosine did not change much the average daily gain, feed intake, or gain to feed. So there's not much of a benefit in that way by feeding tylosine. In terms of the ability to reduce liver abscess, in the past there was work like 30, 40 years ago saying that tylosine would reduce 70 to 50% of liver abscess incidence. But a lot of the new work here shows that it will only reduce between 30 and 35% liver abscess, okay? And this is with a lot of cattle, like thousands of cattle. So it's not going to be a golden bullet here. It's not going to solve your problem. You're still going to have liver abscess even if you use tylosine. We just did work a few years ago here, and we saw that using tylosine, we had only 16% reduction in liver abscess. So looks like from our data that when we have a high incidence of liver abscess, these were cattle that had 50% or more liver abscess. On average, 50% or more of the cattle had liver abscess. We had only 16% reduction. So it seems that as the challenge to the cattle increase, or as there is more liver abscess happening, the effectivity of that antibiotic is reduced. So it's something to think about, because with the pressure to reduce the use of those antimicrobials and that not working as good as did in the past, I think we definitely need to start paying attention more into those other areas that of prevention than just relying on antimicrobial. Here's some work done by group by Walter et al. And in 2018, they published this work, and it was all this work was supported or done by Elanco, a group of Elanco Animal Health, which sells tyrosine, right? And they looked into removing tyrosine from different portions of the feeding or of the feeding period there. So they did a finishing study with for 162 days, right? 162 days on feed. Cattle were in that. They had control where cattle were not fed any antimicrobial and have continuous treatment where they were fed throughout the whole feeding period tyrosine in feed. And then you can see between those two groups that there was a reduction of 35% in liver abscess when they were using tyrosine. And from 8.5%, they reduced to around 5% the A plus liver abscess, which is the biggest issue, like a problem we have in terms of carcass weights and issues at slaughter, right? And economic loss. But they try to remove the feeding of the antibiotic at different periods of that finishing. They fed just for the beginning of that finishing period and not in the last portion, or they fed for the first half of the feeding and not in the second half, and they fed only in the last half and not in the first half. And none of that really worked well. It didn't really help in reducing liver abscess. But when they fed for about 75% from the beginning up to 75% of the days on feed here, 126 days on feed, they did see similar results to when they fed continuously all the way to the end at slaughter. So that shows that there was a possibility to stop feeding tyrosine in the last 25% or so of the feeding period, of the finishing period, and not really have impacts on the reduction of liver abscess. So that could reduce our use of antimicrobial and still have the benefit of the antimicrobial in terms of preventing liver abscess. Another antimicrobial or antibiotic that's been available in Canada to use to prevent liver abscesses, virginomycin, has been approved to use at 20 milligrams per kilo of tyrosine in the diet dry matter for up to 75 days. So you can only feed for 75 days. That's not something that is listed for tyrosine. There's also no pre-slaughter withdrawal with this antimicrobial, so they can be fed until the end. However, there's no compatibility listed, so you cannot. It's not listed that you can feed with monensin. It's not listed you can feed with a beta adrenergic modulator like Experior or Optaflex. So that kind of restricts a bit the interest, I would believe, in terms of like using this product. According to CFIA, they're not listed that you should be feeding together with these other products. This also inhibits gram-positive antibiotic also inhibits gram-positive bacteria, and also is effective against some gram-negatives like the Fusobacterium and the Treponella. Uh, it is effective, or it works by limiting ruminant lactic acid production and acidosis, reducing that risk of subclinical and acidosis, ruminal acidosis, and then reducing liver abscess. So recent work here by Rivera shows that by using virginomycin, beef cattle really did reduce the time spent under pH 5.8, which would be time related to indication of subclinical acidosis. Um, and so that was effective for that. And then Tedeschi and Gorosha Buenfield here in 2018 did a meta-analysis of all the work done with virginomycin, and they saw that it was effective in reducing liver abscess by 29%. So on average, cattle without antimicrobial had 31.7% liver abscess when they look at all those studies, and then it reduced to 22.5%. And the A plus livers, which is our biggest economic issue, from around 19%, it reduced to around 11%. So it was an interesting antimicrobial for that in that study. So I think we've talked quite a bit. It's there's a lot of things to consider when we're thinking about preventing and managing liver abscess in our farms. But definitely, I think we need to start to think more into that integrated approach. Um, things to consider is that the liver abscess pathogens can be isolated even in healthy tissue and healthy livers. So we need to think that we need to be doing everything we can to reduce the stress and support the immune system of that animal so that can continually deal with that pathogen that's continuously reaching the liver to prevent that liver abscesses form. So that's one thing we need to start to think about. We need to make sure we have animals properly adapted to the diets that we're feeding. We need to make sure we're formulating diet properly, that we're not overfeeding protein, overfeeding ingredients, and we are not underfeeding either, but also that we are not overly processing our grains and increase the amount of fines. Got to make sure we manage that with proper processing of grains. We got to make sure we have proper bunk management, making sure the cattle has feed available at every all throughout their time in the feeding and any time throughout the day. They can't be hungry. They shouldn't be hungry, and they should be not competing with each other for feed, because all of that will lead to stress and will lead to off feed events that can lead then to acidosis later. So anything we can do to reduce prevent that intake fluctuation will also be important. It will also support, make sure we maintain our conditions in our pens, that there's not too much mud, that animals that they're clean, right? That animals can reach the feed and access feed and water and good quality water is going to be important, and it's going to help with intake and preventing issues with acidosis. And at the moment, we in feed antibiotics are one other. They do help, and they are one a part of the toolbox, right? And we should be continue to use them for now. I think that there is very poor linkage in the use of these antimicrobials and any antimicrobial resistance in humans so far. So I think they're still important, but they are not the only thing. And as we showed, their efficacy is reducing over the years. Um, and I think we need to pay a lot more attention in the other areas if you want to really make an impact and reduce liver abscess, and not just rely on antimicrobials in feed if we want to solve this issue. With that, I want to thank you, and thank you for the opportunity to speak to you, and thank these beef industry and sponsors and groups in Canada that have been sponsoring my research here in at the University of Saskatchewan over the years. And please reach out if you have any questions, or if through my email, or kind of follow us on X to get our most recent publications in the area. Thank you very much.
Thank you, Dr. Ribeiro, for joining us today and sharing your expertise. You made a complex topic easy to understand, and we appreciate your practical insights that producers can use to improve cattle health and performance. To our viewers, if there is anything you would like clarified, expanded upon, or have a question about, please email events@vealfarmers.ca, and the responses will be shared in our Finishing Grain-Fed Veal Ontario private Facebook group. The learning does not stop here. We are excited to announce we have 2 brand new podcast episodes coming up. The first one Cough is Enough, Rethinking Respiratory Health and Antimicrobial Use with Dr. Bart Pardon, a veterinarian and researcher from Ghent University in Belgium. And the second, Feeding Veal Cattle, Fiber, Rash Ratios, and Rethinking Nutrition with Holly McGill, a ruminant nutrition based in Ontario. Whether you are in the barn or on the go, tune in to SoundCloud or visit vealfarmers.ca to listen in. These episodes are packed with insights you can put to work right away. Thank you for watching, and be sure to visit vealfarmers.ca, Veal Cattle Health, for more information. This project is funded in part by the governments of Canada and Ontario under the Sustainable Canadian Agricultural Partnership, a 5-year federal provincial territorial initiative. Thank you and have a great day.